Welcome to the Rehab Roundup. I am your host, Dr. Hassan, board certified physiatrist and independent practice owner, helping physiatrists start and grow their own profitable practice so that they can achieve financial independence and live without limits. Welcome back to those of you who have attended before, and welcome to those of you who are attending. Today's topic, we will be talking about how to grow and build your practice. One of the big things that I think can be helpful in terms of building your practice is building a consult service. That's going to help on a number of different platforms in terms of being able to establish yourself as an expert, but also establishing a presence in the acute care hospital. For us, that's really where everything begins. Patients are normally completely independent, doing everything on their own. They have some type of acute medical event, which brings them into the acute care hospital. Then what happens is, if they're not safe to go home, somebody needs to make the determination of what appropriate level of care when they leave that acute care hospital. Us, physiatrists, we are the post-acute specialist. So some of the ways you can build and grow your consult service is by kind of targeting a couple different key players in the acute care hospital. One is the therapy team. Two are managers. So how I would go about kind of approaching or marketing myself to the is basically going to the therapy department at that acute care hospital and offering yourself up in terms of lectures, or case studies, or basically say, hey, I'm here and open to discussing difficult patients who you guys are on the fence in terms of determining what's the most appropriate level of care. That way you kind of get in there, you build and grow relationships with the therapy team, but also you kind of teach them the patients that you think are ideal to transition to acute inpatient rehab, SNF, LTAC, so forth and so on. So you kind of set the system up in the way that you want it to be, which is great. It's ideal. That helps drive business in terms of getting you in there on cases and making that recommendation for what you feel is the most appropriate level of care. Also, what you can do is teach them about how to document appropriately for the commercial to make the best case possible if you think the patient is appropriate for transition into acute rehab. So that way it's kind of a double bonus where you're getting that accurate, appropriate documentation for the commercial patients, and you're also getting a consult to kind of help transition that patient to the right level of care. The other key players in the acute care hospital are the case managers. What you can do is basically explain to them how you make life easier. They're all about getting patients in and out of the hospital as quickly as possible. And you can add that component of getting them to the right level of care, talking about key points of decreasing length of stay, but also making sure that the patient doesn't bounce back. Because if you think about it, if you do it right the first time, get them to the right level of care the first time, get them better and get them home, they're not back to the acute care hospital. They're not having prolonged functional deficits that can falls, which subsequently bring them back to the acute care hospital. So you can kind of cut that carousel of patients into the hospital and kind of coming right back. So those are two key players in an acute care hospital that you can kind of target, build and grow relationships with that can help you build a consult service, which in turn helps you build your practice. Next couple weeks or week, I'll be coming out with a really good resource for physiatrists in terms of very good tips on how to build and grow your practice. So that's why I'm kind of speaking to you guys now to kind of prime the pump so that when that comes out, you guys can go out and get that. Thank you for attending Roundup. I am your host, Dr. Hassan, board certified physiatrist and independent practice owner, helping physiatrists start and grow their own practice so that they can achieve financial independence and live without limits. Thank you. Have a good night.